So TrackCare has been architected to support integrated care from its actual original design. Because where TrackCare grew up in Australia, the geographical nature of those healthcare services and demanding the real-time, smooth flow of information across care services, across care teams, to patients and their carers was a fundamental design principle for TrackCare. So bringing that to the UK, TrackCare provides that unified digital platform that enables the real-time flow of information, being able to deliver care in a collaborative, in an interprofessional perspective, supporting clinicians to be able to jointly contribute to the scheduling, the delivery and the management of care for patients, whether they're being provided care across acute, tertiary services or community services, or a combination of all three. The TrackCare digital platform provides that single unified platform to support the concept of integrated and interprofessional care. So improvements in benefits, outcomes and productivity should be really fundamental to the design of an EPR deployment. And that really starts by getting the foundations right, understanding the services, how they work, why they work that way, what works well currently and what needs to be therefore amplified and continue to be supported, but importantly where the opportunities for improvement are, and not just at an organisational level. Really taking the time and the diligence to understand from a frontline perspective how things are working for frontline staff, why it works well, what the opportunities are, what their pains are, where the gains are to be able to be delivered through the deployment of an EPR, and being able to clearly articulate what today looks like and also tomorrow for them, to really set that agenda of high priority benefit outcomes, service improvements for organisations, for teams, for services, for frontline staff, and most importantly, for patients. So I think AI in healthcare is really at a point of inflection at this point. And there's different strategies for how that may move forward. It could be that AI becomes an additional bolt-on tool for healthcare services, helping clinicians, for example, through ambient listening. Or we develop further and really explore the full potential of having AI change our models of care, how clinicians work, and the support that they receive from digital solutions in the delivery, the management, and the planning of care. The latter case is where the true value of AI lives, and that's being able to work alongside as a supportive adjunct to clinicians in providing additional insight, information, and clarity to be able to inform more precise, timely, and effective decision-making for the treatment of the patients under their care. If I could explain today's event in 3 words, I would use strategic. You've been able to understand and hear firsthand from our NHS senior team and leadership as to the future of how they see digital health evolving across the NHS. I think operational, being able to get those insights from frontline clinical services, the current challenges that they're facing and the problems that they're trying to see. And I would say third, collaborative. And whilst we're here as individual suppliers, being able to see colleagues from different industries, from different suppliers, and explore new options to be able to work together collaboratively to deliver greater value and solutions for the NHS.